Emergencies caused by environmental factors can take place in any climate or region. It is helpful to consider the temperature, wind, and weather of the environment when forming a general impression. How the body loses heat. The body can lose heat through conduction, convection, radiation, evaporation, and respiration. Conduction is the transfer of heat away from a warm object to a cooler object through direct contact. An example would be a patient laying on the cold ground. A major element affecting conduction is water, as it can decrease the body's temperature 25 times faster than air. Convection occurs when air or fluid pass over an object, resulting in heat loss. Wind chill is a prime example of exposure to flowing cool air, quickly resulting in hypothermia. Radiation is the emission of electromagnetic waves in the form of heat being released by the body. Areas most prone to heat loss in this fashion are the head and neck. Evaporation occurs when the body sweats. As the water evaporates, a generalized sense of cooling is experienced. Respiration occurs as warm air is expressed from the body. The rate at which an individual will lose heat from respiration is dependent upon the rate and volume in which the patient is breathing. Generalized hypothermia. Hypothermia is caused by the progressive cooling of the body and occurs in 5 stages. During the early stages, the core body temperature drops but is still above 90 degrees Fahrenheit, and the body attempts to warm itself through shivering. As the body's temperature continues to decline, shivering begins to subside, and the muscles start to stiffen. In a 3rd stage, body temperatures drop to 90 to 86 degrees Fahrenheit, and the patient shows signs of altered mental status. During the final stages of hypothermia, the body's core temperature can drop to 85 to 78 degrees Fahrenheit, and the patient loses consciousness. There is an absence of muscular reflex, and the heart may slow down to as little as 10 beats per minute, eventually resulting in cardiac arrest. It is important to note that elderly patients and children are more prone to hypothermia. Assessment. When assessing a patient for hypothermia, keep in mind the ambient temperature, how the patient is dressed, their age, the presence of illness or trauma, as well as whether or not alcohol or recreational drugs have been ingested. Assess for shivering, numbness in the extremities, confusion, rapid breathing or pulse, loss of coordination, muscle rigidity, and pale or cyanotic skin. In extreme cases of hypothermia, the pulse will slow or be absent, and the patient may be unconscious. When assessing the pulse on a hypothermic patient, palpate for at least 30 seconds. Be sure to assess the patient's mental status. Patient care. If the patient is alert with a normal mental status, begin by removing them from the cold exposure into a warmer atmosphere and remove any wet clothing. If the patient is mildly hypothermic, begin to actively rewarm them by placing warm compresses on the armpits, neck, and groin. Be careful not to warm the patient too quickly, as this may cause cardiac dysrhythmia. Next, provide the patient with oxygen, evaluate the vital signs, and transport immediately. If the patient has an altered mental status or is unresponsive, palpate a carotid pulse for at least 30 seconds. If no pulse is felt, begin CPR and apply an AED. If a pulse is present, open the patient's airway and provide high concentration oxygen. Slowly move the patient out of the cold exposure and remove all wet clothing. Passively rewarm the patient by applying blankets. Transport the patient immediately. Note, do not move or rewarm the patient too aggressively, as it can result in a cardiac arrest. Localized cold injuries. Frostnip is a mild localized injury to an area of skin exposed to cold, and it is an initial stage of frostbite. Note, frostnip may occur while the body's core temperature may still be above 96 degrees Fahrenheit. The frostnip progresses to frostbite, and more severe localized injuries occur as blood vessels constrict, preventing warm blood from circulating to the affected area. This may in turn allow ice crystals to form in the exposed soft tissue. When blood circulation is absent for a prolonged period of time, gangrene may develop, which may require amputation. Assessment. Localized cold injuries can be either superficial or deep. In superficial injuries, the injured area may be numb. In patients with dark skin, the involved area will be lighter, and in light-skinned people, the area will present reddened. Areas most likely to be affected are the tips of the ears, nose, fingers, and cheeks. If a superficial injury is left untreated, a deep injury is likely to occur. Deep localized injury can affect blood vessels, muscles, and bones. The affected area may appear blotchy, or in extreme cases, the area will present cyanotic. The skin may feel frozen, however, the underlying tissue will still be soft. The patient will have no sensation in that area. For superficial injuries, treatment involves removing the patient from the cold exposure, warming the injured area with your hands, or blowing warm air onto the site. Do not rub the area. With deep injuries, remove the patient from cold exposure, provide high concentration oxygen, and cover the exposed area. Transport immediately. Heat injuries. When the body is exposed to a temperature higher than the core body temperature for an extended period of time, or the body is incapable of removing excess heat, heat exhaustion begins. If overheating progresses, it will develop into heat stroke. Untreated heat stroke causes organ damage and lead to death within a matter of hours. Assessment. The body tries to cool itself by perspiring, which may lead to excessive fluid and sodium loss and cause muscle cramps. Signs of heat exhaustion include sweating, muscle cramps, weak pulse, rapid shallow breathing, weakness, and dizziness. If left untreated, heat exhaustion may develop into heat stroke. Patients suffering from heat stroke will have an altered mental status, rapid pulse, rapid and shallow breathing, dilated pupils, and dry skin. Treatment. Treatment. Heat exhaustion is normally not life-threatening. Place the patient in an air-conditioned room, loosen or remove clothing, lay them supine with legs elevated, provide high concentration oxygen, and if the patient is alert, provide small sips of water to rehydrate. Heat stroke is a life-threatening condition. Treatment includes placing the patient in an air-conditioned room, removing their clothing, laying them supine with legs elevated, providing high concentration oxygen, and actively cooling the patient by placing ice packs under the arms, groin, and around the neck. Transport the patient immediately.